Bile is this dark greenish-brown liquid that is produced by the liver, stored in the gallbladder, and then released into the duodenum when it's needed. Let's start off really simple with the names of the bile passages. The word pancreatic obviously means to do with the pancreas. Hepatic means to do with the liver. Chole means gall, which is like an old-fashioned word for bile, and cyst means a sac of fluid. And when you put those two together, cholecystic, or just cystic for short, means bile sac, i.e. the gallbladder. And finally, the word common means shared. You know, if you have something in common with someone, it means it's something you share. With those in mind, labeling this diagram should hopefully be pretty self-explanatory, and you're welcome to pause the video if you want to give it a try. There's the right hepatic duct, left hepatic duct, common hepatic duct, cystic duct, and then common bile duct. The common bile duct empties into the duodenum, specifically its second or descending part. If we zoom in, you'll see the very distal end of the common bile duct widens to form this little bulb, which we call the ampulla of Vater. There's a small ring of smooth muscle which holds that opening shut when it's not needed, called the sphincter of Oddi. Together they form this little bump on the inside of the duodenum, basically like a little nipple where bile is secreted, and we call this the major duodenal papilla. Papilla just means bump. Finally, the pancreas gives off two ducts, a main one which joins at the ampulla and an accessory one which joins directly to the duodenum, forming a minor duodenal papilla. That's it for anatomy, so now let's focus on bile itself, what it's made of and what it does. Bile's made up of many things, but there's three that you should remember: bile salts, bicarbonate, and bilirubin. They all start with Bi out of solidarity. And let's talk about what each one does, starting with bile salts. You might have done this experiment as a kid. If you pour oil into water, you'll find that they don't mix. They form two separate layers. Similarly, when you're doing the dishes, you know that just rinsing it under the water doesn't get rid of the oil. And that's just because lipids are not water soluble. So how do we fix that? You add detergent. Detergent emulsifies fats and oils, which is just a fancy way of saying it allows them to mix into water. If you've studied any chemistry, you'll know why. It's because detergent molecules have both polar hydrophilic ends and non-polar hydrophobic ends, so they form micelles with lipids. Bile salts are your digestive system's detergent. It allows the fats and oils you eat to mix into the water around them so that your water-soluble enzymes can then get at them. Alright, moving on to bicarbonate. Bicarbonate neutralizes stomach acid once it arrives in the duodenum. Now, the stomach doesn't get digested by its own acid because the walls secrete mucus to coat itself. The duodenum, however, doesn't have the option to coat itself in mucus because remember, the duodenum's main job is to absorb nutrients. So the nutrients do actually need to come directly in contact with the wall. If you coat it with mucus, it defeats the point of the duodenum. So instead, the acid gets neutralized as soon as it enters the duodenum, and that's what bicarbonate does. Finally, there's bilirubin, which is a waste product from the breakdown of heme. When red blood cells die, heme is released, and unbounded heme is actually quite toxic, so macrophages phagocytose them and convert them to a less toxic form called unconjugated bilirubin. Unconjugated bilirubin is not water-soluble, so it gets sent to the liver, which conjugates it into a more water-soluble form, which can be incorporated into bile and then expelled via the gut. Alright, moving on to gallstone diseases. Remember this? We're adding a few more. Doco means duct. Angio means vessel or duct, they're pretty much the same. Lith means stone, iasis means process or phenomenon, and itis means inflammation. Now, bile salts in the gallbladder sometimes precipitate out of solution and crystallize, forming stones. This process is called cholelithiasis, gallstone phenomenon. It's actually fairly common. There may be many people walking around with gallstones without even knowing it. I mean, if the stones are just sitting there, they might not cause any symptoms, in which case there's not really any reason to treat it either. Many people go for the rest of their lives without the stones ever becoming a problem, so subjecting them to surgery may be an unnecessary risk. There are certain exceptions, but in the majority of cases, the current professional consensus is that asymptomatic cholelithiasis does not warrant surgery. However, imagine instead that a stone gets lodged at the neck of the gallbladder. Now each time the gallbladder tries to squeeze, it will be contracting against that resistance, and that's felt as this intense gnawing pain in the right upper quadrant, most commonly after fatty meals because that's when the gallbladder tries to release bile, and this is called biliary colic. While biliary colic itself is not dangerous, it is very unpleasant, and so you can justify that surgery will improve the person's quality of life, and you'd schedule them for an elective cholecystectomy to remove the gallbladder. Now say the stone was lodged somewhere in the cystic duct. As a general principle, anytime you block a blind-ended tube in the human body, you're going to get an infection behind it because it distends and occludes the veins around its mucosa, and that just allows infections to fester. And of course, in the gallbladder, this is called acute cholecystitis. This would be an indication to do an emergency cholecystectomy and take it out straight away. I should add that most people can still live a pretty normal lifestyle without a gallbladder. Remember, the gallbladder doesn't produce bile, the liver does. So bile will still flow, it will just do it continuously instead of being stored and bolused with every meal, which means you might potentially get some diarrhea if you have a sudden fatty meal, but generally they can have a normal lifestyle and diet. Now say a stone gets lodged even further downstream in the common bile duct. Now both the liver and the gallbladder are blocked. This is called choledocholithiasis, bile duct stone phenomenon. And you can figure out its symptoms based on your knowledge of bile's composition. Bilirubin can't get out, so it builds up in the body, causing jaundice. You don't have bile salts to emulsify fats, so any fats you eat goes right through the digestive system and comes out as pale, fatty stools called steatorrhea. One of the complications of choledocholithiasis comes from the fact that the intestines, as you know, are filled with lots of gram-negative bacteria like E. coli and Enterobacter. Without the flow of bile to flush them out, these bugs could climb up the bile ducts. This is called ascending cholangitis and can be very serious. The patients tend to present quite septically with Reynolds pentad of fever, right upper quadrant pain, jaundice, confusion, and shock. Finally, if a gallstone lodges in the ampulla, the pancreas is blocked too. When the pancreatic enzymes can't flow, they may prematurely activate and digest the pancreas itself, causing acute pancreatitis. And in fact, gallstone pancreatitis is one of the most common causes of acute pancreatitis. To remove stones from the common bile duct or ampulla, the patient needs an ERCP, which is a procedure in which an endoscope is passed into the duodenum and feeds a wire through the major duodenal papilla to fish out the stone. That's all for this tutorial. I hope it made sense. It was a bit experimental, but get in touch if you have any questions.